cannabis be used against cancer? Some people swear by cannabis as a virtual cure, all for all types of cancer, yet the medical establishment is nowhere close to including it as part of the standard of care of any cancer type. But what does the evidence say? In this video, we will examine the mechanism of action of cannabis and the human data regarding its efficacy. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. A history of cannabis and cancer cannabis has been used medicinally for approximately 5,000 years, and during cancer care for about 2,500. Cannabis preparations are currently approved for symptoms of multiple sclerosis, epilepsy, and cancer treatment-related side effects. Yet due to cannabis being illegal in most countries, research into it has remained underdeveloped. Even so, this has not dissuaded cancer patients from using cannabis during treatment. It is estimated that between 18 to 30% of cancer patients use cannabis, many of them obtaining it without a prescription and without consulting a doctor. Popular culture is filled with depictions of cannabis benefiting cancer patients, from documentaries such as Weed the People to news stories to social media. After seeing such dramatic remissions with your own eyes, they cannot be unseen. The clinical and preclinical evidence for cannabis used during cancer is positive, even extremely positive in many circumstances, but is nuanced as there are some cases where cannabis would actually be contraindicated. Factors that influence cannabis's efficacy include strain of cannabinoid, dosage, form, cancer type, concurrent therapies, and even time of administration. Only once we understand all of these things can anyone form an opinion as to if cannabis might be right for them. Mechanism of action. Cannabinoids have a wide variety of mechanisms against cancer, including the inhibition of angiogenesis, induction of apoptosis, downregulation of cell adhesion molecule ICAM1 to decrease the risk of metastases, inhibition of mTOR, increase of reactive oxygen species, ROS, upregulation of tumor suppressor gene p53, etc. In short, cannabinoids exhibit many of the same mechanisms of many effective cancer-fighting drugs and supplements. However, its one mechanism that is unique is its interaction with the endocannabinoid system. The endocannabinoid system is composed of endogenous cannabinoids, such as anandamide, and their receptors, CB1 and CB2. CB1 is primarily found in the brain and central nervous system, while CB2 is located on B lymphocytes and natural killer cells, suggesting a possible role in immunity. The endocannabinoid system's primary roles are to affect energy metabolism and immune system homeostasis, the ability of your immune system to stay balanced between inflammatory and anti-inflammatory reactions. More advanced cancers tend to have a higher proportion of CR1 receptors. Additionally, pediatric cancers, especially brain cancers, also have a higher proportion of CR1 receptors. Cannabis contains at least 113 compounds, known as cannabinoids, but the two most well-known for their cancer-fighting effects are delta-9 tetrahydrocannabinol, THC, and cannabidiol, CBD. THC is psychoactive and interacts with both the CB1 and CB2 receptors, but has a particular affinity for the CB1 receptor. Chronic doses of up to 1,500 milligrams per day of CBD have even been found to be well tolerated in humans. It should be taken with food to maximize absorption. The anti-cancer effects of THC and CBD do synergize, but it seems like CBD has a more dramatic anti-cancer effect than THC. For instance, take this chart showing survival in a mouse model of glioma, dosed with different concentrations of THC and CBD. The 1:5 THC to CBD strain has a far better response than the 1:1 strain, which barely even achieves a positive response. TZM in the chart is the standard of care anti-glioma drug temozolomide. It demonstrated synergy with cannabinoids. Lastly, another non-psychoactive cannabinoid, cannabigerol, CBG, is gaining attention. Cell line studies in glioblastoma have indicated that it can double the cancer-killing power of CBD. CBG is currently available in commercial tinctures mixed with CBD. Are cannabinoids immunosuppressive? Cannabinoids are often referred to as immunosuppressive, but a better term may be biphasic, meaning they have different effects at different dosages. Some of the initial studies of cannabis showed an immunosuppressive effect on immune cells at high concentrations, while immunostimulatory effects were observed at low concentrations. When CBD was administered to mice 3 times a week rather than daily, overall survival increased and metastases decreased, illustrating a stronger anti-cancer effect for the lower dose. Side effects. Although cannabis has many side effects, particularly cognitive, not related to cancer management, we are going to describe the side effects as they primarily pertain to cancer. Like curcumin, it may decrease the bioavailability of breast cancer drug tamoxifen. Additionally, cannabinoids have also been found to reduce pain and limit dependence on opioids, decrease chemotherapy-induced nausea and vomiting, increase appetite, and improve mood. All of these are typically beneficial during cancer treatment. The supplement piperine synergizes with cannabis, increasing CBD's bioavailability by 250%. Contraindications. There is no stronger contraindication against using cannabis during cancer treatment than concurrent use of immune checkpoint inhibitors. 2 studies so far have confirmed cannabis's ability across a variety of solid tumors to decrease the response rate of immune checkpoint inhibitors, dropping it from 37.5% down to 15.9%. Cannabis use did not lead to a significant decline in overall or progression-free survival, but it also did not provide any benefit. It is speculated that cannabis's calming effect on the stomach might hinder immunogenic activity, as so much of the immune system is located in the gut. Form smoking has been shown to increase the bioavailability of cannabis from 20% when ingested to 45%. One way to avoid the tar produced by smoking a joint while still retaining high bioavailability is by vaping. Other forms that cannabinoids come in are oils and concentrates. Both of these are extremely popular and are used in the majority of human trials and case reports. Concentrates, sometimes known as Rick Simpson oil, RSO, are probably the most promising form of cannabis for treating illness. Normally, no more than a grain of rice is taken as the dosage for RSO. Cancer incidence. A meta-analysis of 34 trials found a negative correlation between cannabis use and cancer incidence, with the exception of testicular cancer, which showed an increase. Head and neck cancers showed a 17% reduction in incidence. Animal evidence. The first animal trial in the scientific literature studying the effects of cannabis on cancer came at the behest of the US government in 1974. The National Institute of Health had hoped to find evidence that cannabis hinders the immune system, thereby inducing cancer. What the experiment actually found was that THC slowed the growth of leukemia, lung, and breast cancers, prolonging the animals' lives as much as 36%. The DEA shut down the study, and research into cannabis was not resumed for decades. Since that time, the findings of animal trials have been overwhelmingly positive regarding cannabis's effects on cancer. A recent review found that all 16 in vivo studies evaluating the effects of cannabinoids on glioma showed statistically significant reductions of tumor volumes when compared to controls. Human studies. Human research of the effects of cannabis on cancer is extremely new. Here we provide a representative sample of the human data. In 2017, 11 refractory glioblastoma patients received 12 sprays a day of a 1 CBD THC oromucosal spray for about 30 mg a day of both CBD and THC, concurrent with the glioblastoma drug temozolomide, while 9 patients received placebo. The 1-year survival in the cannabis group was 83.3%, while it was 44.4% in the placebo group. A 2018 study examined 119 patients with a variety of cancers, primarily breast cancer and brain tumors, who received CBD as part of their treatment, or in some cases as a monotherapy. Responses rates reached 92%. The authors described 2 cases that were particularly impressive. The first was a 5-year-old boy who had anaplastic ependymoma, a very rare brain tumor. He had all standard treatments, surgery on 2 occasions, followed by chemotherapy and radiation. No further treatment options were available to him when he initiated CBD use in February 2016. A December 2016 scan showed that tumor volume had decreased by 60%. Further scans continued to show stable disease. Another case highlighted was a 50-year-old man with progressive tannicytic ependymoma, another rare brain tumor. He received radiation, then refused chemotherapy. Faced with no further treatment options, he began using 10 milligrams of CBD 2 times a day. Approximately half a year after initiating CBD, his scans showed regression. A 2019 case report examined 9 patients with primary brain tumors, 8 of whom received 400 milligrams of CBD a day concomitant with standard of care. 1 received 400 milligrams per day of CBD as a monotherapy. All of the patients described, but 1 were alive at the time of publication with a mean survival time of 22.3 months, longer than was expected. In 2021, 88 people with recurrent and/or inoperable glioblastoma, 84, or astrocytoma, 4, were given cannabis oil concurrent with standard of care. The cannabis oils were either 4:1 THC to CBD or 1:1 THC to CBD and administered in different dosages. 11% of the cannabis group had a regression of their tumors. None of the historically matched controls did. The 1:1 THC-CBD ratio was more successful than the 4:1, indicating CBD may be more anti-cancer than THC. More information about cannabis and cancer treatment can be found in the book Cancer Self-Defense 101 Quick Tips to Help You Survive.